Hello guys, this is Mahajan Aditya from first year post IMU from group 1A. Today I am here to explain the external organs of male reproductive system. Male reproductive system contains two parts, external organs and internal organs. External organs contains penis, testis and scrotum. And internal parts contains prostate gland, vas deferens, urethra, epididymis, seminal vesicles and etc. But I will today explain only the external genitals, penis, testis and scrotum. Now we will see about penis. Penis is male copulatory organ. It reaches its maximum size at puberty level. Its sizes from 8.8 cm to 12.9 cm. When it is erect, it sizes up to 12.9. There are four parts of penis: glans penis, shaft, foreskin and frenulum. Glans penis is the tip of the penis. Shaft, from the tip of the penis to the end of the penis is known as shaft. Foreskin. In uncircumcision men, the glans penis is covered by foreskin, and in circumcision men, foreskin is removed surgically, and it is also known as prepuce. And the frenulum, the tissues which connects glans penis to foreskin is known as frenulum. The shaft contains two more parts, that is corpus cavernosum and corpus spongiosum. Corpus cavernosum is to erect the penis, and corpus spongiosum fills the blood vessels from the penis. Now we will see the clinical features of the penis. First clinical feature is erectile dysfunction. Erectile dysfunction, in this disease, the penis can't reach its maximum size. The major cause of this is atherosclerosis. Atherosclerosis is damage of vessels. Second clinical feature is penile cancer. Penile cancer symptoms that blood in urine, blood in semen, blood in foreskin and many more. Now we will see the second organ, testis. The testis is a paired organ located below the penis and outside of human body. It consists Leydig cells which used to make testosterone, tunica albuginea, retitestis, epididymis and vas deferens. Testes are located outside of the body. It is a paired organ and it produces semen and testosterone. And it is, now we will see the clinical features of testes. First clinical feature is cryptorchidism. Cryptorchidism is that when the testes can't descend to the scrotum, it lays in abdomen, is known as cryptorchidism. And monorchidism, when one testis can't descend to scrotum, is known as monorchidism. Now we will see about scrotum. Scrotum is the pouch-like structure in which testes are present. Scrotum has 6 layers. That is skin. It is from superficial to deep. First one is skin. Second one is dartos fascia or dartos muscle. Third one is external spermatic fascia. Then there is premaster muscles, the internal spermatic fascia and tunica vaginalis. Function of scrotum. Function of scrotum to maintain the cool temperature 2 to 3 degrees than the body temperature to form the semen or sperms. And the second function is to protect you guys. I have explained the external organs of male reproductive system, which I explained you. This is the penis, this is the glans penis, this is the urethral meatus, this is the shaft. The line joining the foreskin to glans penis is frenulum. Now I will say the second organ. This is the testes, which are covered in this pocket, is known as scrotum. Thank you.
Assalamu alaikum guys. I am Naba Noor from first year 1A group. Today my topic of presentation is joints and its types. First of all, what are joints? When two or more bones articulate with each other, they form joints. There are total 230 joints in human body. Then classification. The joints are classified into 3 types: fibrous, cartilaginous and synovial. First of all, fibrous joints. They are basically known as skull joints. They are completely immovable joints. They are present in sutures of skull. In our skull, we have 4 sutures: metaphyseal, sagittal, cranial and lumboid. Okay. Then they are present in gum forces. What are gum forces? Gum forces are present between the upper and lower jaw of the teeth, which are known as peg and socket joints. They show less mobility than syndesmosis. That is found between the forearms, linked with strong membrane and ligament. Okay. Then cartilaginous joint. They are basically pelvic joints. They show slightly movement. It has two types: primary cartilaginous joint and secondary cartilaginous joint. First, synchondrosis. The word chondrosis means cartilage. Okay. It has complete articulation with hyaline cartilage. It shows less movement. Its example is epiphysis diaphyseal joint. Then secondary cartilaginous joints. They are present in midline of body. They show less movement. Pubic symphysis is its example. Now, synovial joints. They are freely movable joint and they have synovial cavity inside. Look here over, it is a diagram of synovial joint. It has bones, the cavity, capsules, articular disc over here. Okay. Now the types. Synovial joint have 7 types. First of all, hinge joint. Hinge joint basically show the forward and backward movement. Look over here. It is the movement of hinge joint. Elbow and phalanges are example. This and this. Second, condylar joint. They are present in metacarpals and phalanges. Look here, it is its diagram or movement. Then saddle joint. Saddle joint is a thumb joint. Look over here, it is the movement of saddle joint. Then ellipsoid joint. Ellipsoid joint is wrist joint, and look over here, it is ellipsoid joint. Its movement is back and forth and this. Then pivot joints. It is superior radioulnar joint. Over here we have radius and ulna, the superior part. Okay, and it says movement. Then ball and socket joints. These joints show 360-degree movement, like our shoulder. It moves 360 degree. I can show you like this. It is moving now. It shows 360-degree movement. It is ball and socket. Same like this, hip joint. It shows 360-degree movement. Okay, last, plane joint. It is sternoclavicular joint. This is our sternum. This is our clavicle. This joint is present over here. Okay, thank you. That's
Hello
it.
guys, myself Rahul. I am from group 1A. Today I will be explaining about regional classification of bones. So firstly, there are two types of skeletons. First is the axial skeleton. In the axial skeleton, there is skull. Skull consists of the cranial skull, which consists of 8 bones. Then there is facial skull that consists of 14 bones. Then we count ear differently, which has 6 bones. Then there comes the ribs. They come in pair. There are 12 pair of ribs, counting up to 24. In vertebral column, there are 26 vertebrae. In sternum, there is only one sternum and one floating bone called hyoid. Nextly, there is appendicular skeleton. In the appendicular skeleton, there are 2 upper limbs. There are 60 bones in counting in both upper limbs. Then there are 2 lower limbs, adding up to 60 bones. There is pectoral girdle, which connects the appendicular to axial skeleton. That adds up to 4 bones. Then there is pelvic girdle, which consists of 2 bones. Then nextly we come to the upper limb. Upper limb consists of 1 humerus, 1 radial, 1 ulna, 8 carpals, 5 metacarpals and 14 phalanges. So here we have our upper limb. This long bone is the humerus. The thumb side bone is radius. The bone that's attached with makes a joint with the humerus, that is our elbow joint, is the ulna. Here you can see the carpals. There are total of 8 carpals. These 5 bones are 5 metacarpals, and the fingers are fingers. Here are the 14 phalanges. Nextly, we have the lower limb. Lower limb consists of one femur, one patella, one tibia, one fibula, 7 tarsals, 5 metatarsals, and same number 14 phalanges. So let's move on to our lower limb. This is the longest bone in our body, known as femur. Between the femur and tibia, we have a small joint called as patella. Then this bone is called as tibia. This bone is the fibula. There are 7 number of tarsals, as you can see here. These are the 7 tarsals in our body. These are the 5 metatarsals, and these are the 14 phalanges down there. So let's move on to our pectoral girdle. The horizontal bone you can see here is the clavicle, and in the behind, the triangular bone you can see here is the scapula. Pectoral girdle consists of 2 clavicle and 2 scapula. Now the pubis girdle. The pubis girdle consists of 2 hip bones. The bone that you can see here is the one hip bone, and this one is the another hip bone.
My name is Mehekan Gohar, and I am from first year 1A group, and today I will explain facial expression muscles. Facial expression muscle regulate 3 openings: palpebral fissure, oral fissure, and nostrils, out of which orbital fissure and oral fissure have the most developed muscles. Then we have occipitofrontalis muscle. It is placed here. Occipitofrontalis muscle. It has frontal belly here and occipital belly here. Then we have occipitofrontalis muscle function. Occipitofrontalis muscle may move scalps and raise eyebrows, and it is also called the muscle of surprise. Then we have procerus muscle. Procerus muscle makes the transverse wrinkle across the root of the nose, and it is also called muscle of dislike. It is used in frowning, and here you will see the procerus muscle makes transverse wrinkles. Then we have corrugator supercilii muscle. It makes wrinkles on forehead, vertical wrinkles. It is also called the muscle of dislike. Then we have superior, medial, and posterior orbicularis. Here it is superior, middle, and posterior orbicularis muscle. It's a vestigial organ. In the past it was used, but still now it is not in used. Maybe it sometimes is used in some reflexes. And then we have orbicularis oculi. Orbicularis oculi. This is the orbicularis oculi. It has 3 parts: palpebral part, orbital part, and lacrimal part. And the palpebral part is, its function is, it is helpful in the gentle closing of eyes, like in sleeping. Then we have that orbital part. It is for the forceful closure of eyes, like in the situation of dust, high intensity light, and rain. Then we have a lacrimal part here, and its work is the dilation of lacrimal gland. Okay. Then we have zygomatic major and zygomatic minor muscle. The function of zygomatic major muscle. Here is our zygomatic major muscle. Its function is, it is used in smiling, like broad smiling, and it is also called laughing muscle. And this muscle, zygomatic minor muscle, is called muscle of contempt. Then we have risorius muscle. You can see here, this is risorius muscle. This is risorius muscle. It is called the muscle of grinning, and it is also called muscle of broad smiling. Then we have orbicularis oris muscle. This is orbicularis oris muscle. It is for the closing of lips, pouting and twisting like this. And we have levator labii superioris. This is for the elevation of lips superiorly, and its depressor labii inferioris. Its function is to depress, to move the lip downward. It is also called a muscle of sadness and sorrow. And here at our chin there is a muscle called mentalis. It is also called muscle of doubt. It makes wrinkles on our chin like this. Okay, and our last muscle is nasalis. It's the muscle of nose. Thank you so much.
My name is Abbas. I am student of Post International Medical University. Today, the topic of my presentation is digestive system. I will explain digestive system from mouth to anus. First part is mouth, made of two parts: vestibule and oral cavity. Vestibule contains lips and cheeks. Oral cavity contains palatine. Palatine lies soft palatine and hard palatine. Then we talk about tongue. Tongue has two muscles: intrinsic muscle and extrinsic muscle. Intrinsic muscle contains help in shape, and extrinsic muscle help in movement. Then we now talk about taste buds in salivary glands. Teeth of the tongue is salty. The side of the tongue is sweet taste, and lateral part of the tongue is sour taste, and central part of the tongue is umami taste, and posterior part of the tongue is bitter in taste. Now we talk about pharynx. Pharynx is made of three parts: nasopharynx, oropharynx, and laryngopharynx. Now we talk about esophagus. It has three parts: cervical parts, thoracic part, abdominal part. Cervical parts contain 4 cm long, thoracic part 20 cm, and abdominal part 1 to 2 cm. It has 4 constructions: pharyngeal constructions, and aortic constructions, and bronchial constructions, and diaphragmatic constructions. Now we talk about liver. It helps in enzyme activation and metabolize drugs, bile production, and fats. Now we talk about gallbladder. It contains bile duct helpful in breakdown of fats. Now we talk about stomach. It is greater curvature of stomach, convex in shape. It is lesser curvature of stomach, convex in shape. And it is made of 3 muscles: circular muscle, longitudinal muscle, and oblique muscle. It has 3 curvatures. It has 2 sphincter: cardiac sphincter and pyloric sphincter. Then we talk about pancreas. It is leaf-like structure situated at duodenum. Then we talk about small intestine. It contains with duodenum. It comes like hair. Then we talk about large intestine. It has 4 parts: descending colon, transverse colon, ascending colon. After that we have sigmoid. After that we have rectum and anus. It contains appendix. Explain on diagrams. This part is mouth, and this part is teeth. This part is tongue. It has salivary glands and pharynx. This long tube is pharynx, and this is epiglottis. And this is esophagus. This is liver. This part is gallbladder. This is pancreas, and this is stomach. It is J-shaped. This is large intestine. This part is small intestine, and this is appendix. This is rectum. This part is anus.
Today I will discuss kidney with you. Kidney is the organ in our body. The main function of kidney is the filtering of blood and making urine. Then we discuss its location. It is present below the rib cage. The right kidney is lower than the left one because of the presence of liver. It is 3 cm thick, 12 cm long, and 6 cm wide. In males, it is about 129 gram for right kidney and 137 gram left kidney. The left kidney is more weighted than the right kidney. In female, it is 108 gram right kidney and 116 gram left kidney. structure. It is bean shaped, about the size of fist, and reddish brown in color. Then we discuss its function. The main function is removing various products, maintaining hemostasis, and making urine. Then we discuss nephron. They are million in number in our kidney. The nephron is the filtering unit of kidney and the functioning unit of kidney. Its main function are reabsorption, secretion, excretion. It filter about 150 quarts of blood per day. 1 to 2 quarts make urine, and all the other remain in our blood, remain in our body. In a minute, every cup, it's filter every cup of blood every minute, half cup of blood every minute. Reabsorption of nutrients. Kidney reabsorb nutrients like glucose, water, amino acid, phosphates. Blue are the renal arteries. They carry deoxygenated blood from our body, and then kidney filters the blood. And the red one are the renal veins. They carry oxygenated blood from kidney towards the body. Kidney helps in reabsorption of nutrients like glucose, water, amino acid, phosphate, and different salts. It also maintaining the pH of blood in kidney. The normal pH is 7.35 to 7.45. Regulating blood pressure of our body. Kidney has major two disease: kidney stone and kidney failure. Lithotripsy, we use non-electrical shock waves, and the kidney failure treatments are dialysis and kidney transplant. There are two types of dialysis: hemodialysis and peritoneal dialysis. In peritoneal dialysis, it directly touches to our abdomen. We can do it daily basis. In hemodialysis, we use a artificial dialysis machine which work as our kidney. We do 2 times in a week. Otherwise, kidney transplant is another option.
Group 1A. Today the topic of our presentation is digestive system. Okay, let's start. Break down food into smaller and smaller components until it can be absorbed and assimilated into our body. Our digestive system starts from our mouth. Firstly, digestive system starts from mouth. It has 2 parts, vestibule and oral cavity. Vestibule interior is made up of lips and cheeks, and posterior it is made up of teeth and gums. We have inside second-molar teeth, we have gland called parotid gland of papilla. Oral cavity, it has 2 parts, root and floor. Root anterior 2/3 of palatine. We have palatine process of maxilla, 2 bones, and horizontal plates of palatine. Okay. We have also clinical feature of soft palate. In this, we have to say R to the patient if there is elevation of soft palate and uvula. If there is no elevation, patient has tumor or damage of cranial nerve number 11. And we have innovation here, trigeminal nerve. Okay, let's start about floor. It is made up of tongue and frenulum, made of fold of mucus membrane. It stabilizes us and hold our tongue for chewing, talking, and holding our food. Okay, let's start our second part, that is tongue. Tongue is made up of striated muscles and covered by mucous membrane. It has 2 types, intrinsic muscle and extrinsic muscle. Intrinsic muscle is responsible for the shape of the tongue, and extrinsic muscle we have mnemonic called he pretends, stylish, and genius. He for hypoglossal muscle, T for palatoglossus muscle, stylish is for styloglossus muscle, and genius is for genioglossus muscle. Genioglossus muscle is also called as safety muscle of our tongue. When we are in spine position, our tongue goes outward, and this muscle take our tongue out towards the mouth. That's why our tongue is safe. And we have innervation, 2 innervation of nerves, lingual nerve and chorda tympani nerve. Chorda tympani nerve is responsible for taste. It is for taste for salt. Lateral part of our tongue, it is for taste for sour, and middle is for taste for sweet. And posterior to middle we have taste called umami, and posterior both sides we have taste called bitter.